Welcome to the deep dive. Today we're tackling something tiny, maybe, but definitely troublesome for lots of our pets, ear mites.
Yep, those little guys. We've
Yeah.
got some really good info pulled together.
And our mission really is to get under the skin of these pests, what they are, how you spot them, and crucially, how you deal with them.
Exactly. We're talking Otodectes cynotis, technically speaking. Tiny mites that just, well, love living in the ear canal. Causes a lot of grief.
So stick with us and you'll get the essentials, the signs, the causes, how vets figure it out, and the treatments. Let's jump right in. Who usually gets these?
Well, you often see them, probably most commonly, in younger animals. Puppies, kittens, that sort of thing. But honestly, any dog or cat can get them. Age isn't really a barrier.
Right, so it's not just a puppy or kitten problem then. Good to know. What about breeds? Or, male versus female? Any difference there?
Interestingly, no. The sources we looked at don't really flag any specific breed or sex as being more likely to get ear mites. Seems like they're equal opportunity invaders.
Okay, equal opportunity pests. Got it. So let's say you see your pet scratching like crazy at their ears. What are those first signs, the real giveaways?
The number one thing is definitely the itching. Pruritus, we call it.
Pruritus, right?
And it's not just a quick scratch. It can be mild, sure, but often it's pretty intense, like obsessive scratching.
And is that itching just concentrated right around the ears, or does it spread?
Mostly, yeah, it's the ears, head, neck area. That's the main zone. But sometimes, the irritation can become more generalized. It can spread.
Okay. And the classic ear gunk people talk about. What's that look like?
Ah, yes, the discharge. It's usually this thick, kind of red-brown or even black stuff.
Black. Okay.
Yeah, and the classic description you always hear is that it looks like coffee grounds. You'll typically see it down the outer part of the ear canal.
Coffee grounds. That's a very vivid description. Easy to remember, I guess. But does every case look that bad? Does it vary?
Oh, absolutely. It varies a lot. The amount of that exudate the gunk and how much the animal actually itches, well, it can be really different from one pet to the next.
So you can't just expect to see the exact same thing every time.
Nope. Some might have loads of discharge and minimal itching. Others might be scratching furiously with hardly any visible discharge.
Are there other signs, maybe? Anything specific to dogs we should know about?
Yeah, with dogs, sometimes you'll also see crusts forming, maybe some scaly skin. And not just on the ears, it can pop up on the neck, the rump area, even the tail.
Interesting how it travels, and sometimes you see sore spots on the actual ear flaps, the pinnae. What causes those?
That's almost always self-inflicted, unfortunately.
Ah.
The itching is so bad that they scratch and scratch,
Yeah.
and they end up causing these abrasions, these excoriations on their own ear flaps.
Ouch. Makes sense, though, if it's that itchy. Okay, so we know the signs. What's the actual culprit, the root cause?
It's pretty straightforward, actually. The direct cause, the only cause, is an infestation with the Otodectes cynotis mites themselves.
Just the mites, nothing else.
Nope, they're the ones doing all the irritating work.
Simple enough. So if you suspect ear mites, you see the signs, you take your pet in. How does the vet confirm it? What's the diagnostic process?
Well, first, they'll want to rule out other things that might look similar.
Like what?
Things like other types of mange, maybe sarcoptic mange, which is also super itchy, or even something like notoedric mange in cats. Flea allergies can cause ear issues too, or just general allergies causing otitis externa, that's ear inflammation.
So quite a few possibilities that could look like mites.
Exactly. That's why a proper diagnosis is important. Things like pediculosis, lice, or even piloderma dermatitis, chiggers.
Yeah.
They're all on the list of possibilities, the differential diagnoses.
Okay. What about like blood tests? Do they show anything?
Generally, no. Standard lab work, CBC, biochemistry, urinalysis, it all usually comes back normal with just ear mites. They're more for checking overall health or other potential problems.
So the real key is looking for the mites themselves.
Precisely. The gold standard, really, is taking a swab from the ear canal. Get some of that debris, mix it with a drop of mineral oil on a slide, and look under the microscope.
And you can just see them.
Yep. If they're there, you can usually spot the little white mites moving around in the oil. Pretty definitive.
Wow. Okay. Any other ways to find them?
Well, if the signs are more widespread on the body, not just the ears, the vet might do skin scrapings from those areas. And sometimes, if it's a really heavy infestation, you might actually see them directly in the ear canal with an otoscope.
Just see them crawling around.
Potentially, yeah.
Or-
Little white specks. And there's also the idea of sort of diagnosis by treatment.
How does that work?
If you strongly suspect mites, maybe you couldn't find them on the swab for some reason, but you treat for them anyway.
Yeah.
If the pet gets clearly better, that's pretty good evidence you are on the right track.
Gotcha. Okay, diagnosis covered. Now the big question, getting rid of them. How's the treatment usually handled? Is it a hospital stay?
Oh no, almost always outpatient. Your pet gets treated, and then you manage it at home.
Any special diets or exercise restrictions needed?
Nope, nothing like that. Normal routine is fine.
Okay. Now, you mentioned earlier how contagious these are. The info really stresses that, doesn't it?
Hugely important point.
Yeah.
Ear mites spread super easily between animals through direct contact.
So if one cat has it.
Then all the animals, dogs, cats, ferrets even that have been in contact need to be treated. Every single one, even if they look perfectly fine.
Wow, okay. That's critical for people with multiple pets. What about, like, the house? Carpets? Bedding? Can mites live there?
They can survive off the host for a little while, yes.
Yeah.
So thoroughly cleaning bedding, vacuuming carpets and furniture, it's definitely recommended. Maybe even using an environmental treatment in some cases to really nail any stragglers.
Right, don't want them just hopping back on. Okay, let's get into the meds, the topical ones, the stuff that goes right in the ear. How do those work?
So for topical attic parasiticides, the first step is always cleaning the ears. Really important.
Why is that?
You need to get all that wax and debris, that coffee ground stuff, out of the way so the medication can actually reach the mites and the ear canal lining. Usually use a commercial ear cleaner.
Okay, clean first, then medicate. Makes sense. How long does that go on for?
Typically, you'd apply the medication daily for about 7 to 10 days. That's designed to kill the adult mites and the hatching eggs.
Just one round.
Well, some sources actually recommend maybe doing it for a week, stopping for a week, then doing another week for maybe 2, 3 cycles like that.
Why the breaks?
The idea is to catch any mites that hatch from eggs that might have survived the first round of treatment. It targets the life cycle more effectively.
Clever. What kind of active ingredients are we talking about in these eardrops?
You see a few common ones. Things like pyrethrins, which are pretty common insecticides, thiabendazole, ivermectin can be in some topical forms, emetraz, milbemycin. There are several options.
Okay, so drops are one way. Are there other options, maybe pills or injections?
Yeah.
Systemic treatments?
Yes, there are systemic options too. Selamectin is a common one. It's a spot-on treatment you put on the skin, usually between the shoulder blades.
Like flea treatment.
Exactly like that. It gets absorbed and circulates through the body to kill the mites in the ears. Dosage is by weight. Follow the label. Sometimes a second dose is needed after a couple of weeks.
Any others?
There's also a combination product, imidacloprid plus moxidectin, another spot-on that works systemically. Again, use as directed by the label.
I see ivermectin mentioned again here, but it says non-FDA approved usage. What's that mean?
Right. So while ivermectin is effective, and vets sometimes use it, especially for tricky or widespread cases, giving it by mouth or injection specifically for ear mites isn't an officially FDA-approved use for that drug. It's considered off-label use.
But vets still do it.
Sometimes, yes, based on their clinical judgment, there are specific dosages and schedules, maybe giving it orally a few times or as injections spaced 2 weeks apart.
Interesting. And it also mentions using regular flea treatments. Why is that important?
Good point. Even though the mites mostly live in the ears, some might wander out onto the body. Using a good flea and tick product can help kill any of those stray mites, just gives you better overall coverage.
And back to the environment, is treating the house always necessary?
It's often recommended as a backup. Since the mites can survive for a bit off the animal, cleaning thoroughly and maybe using an appropriate spray can help reduce the chance of your pet picking them right back up again. It's part of being thorough.
Okay, now this next part seems really, really important. Contraindications and interactions. Are there pets that shouldn't get certain meds?
Absolutely. This is critical safety information. Big warnings around ivermectin and moxidectin, especially the oral or injectable forms.
What kind of warnings?
They should not be used in collies, shelties, Old English sheepdogs, Australian shepherds, related breeds or crosses of these breeds.
Why not?
They have a genetic sensitivity, often called the MDR1 mutation, that makes them unable to process these drugs properly. It can lead to severe neurological problems, even death. It's incredibly dangerous for them.
Wow. Okay, definitely avoid in those breeds.
Yeah.
Any other precautions?
Yes. Use these drugs very cautiously, if at all, in any animal under 6 months old. And there are growing reports of toxicity issues, specifically in young kittens. So, extreme care is needed there.
Okay, breed and age are huge factors. What about mixing medications? Any potential drug interactions?
Yes, that's another watch out. Ivermectin and also milbemycin can affect certain chemicals in the brain, monoamine neurotransmitters,
Which means?
which means they could potentially interact badly with other drugs that affect those same pathways.
Yeah.
Things like amitraz, which is in some tick collars or dips, or benzodiazepines, which are sedatives like diazepam.
Because you could accidentally cause a problem by combining meds.
You could. That's why it's absolutely vital that you tell your vet about every single thing your pet is taking, other prescriptions, supplements, flea treatments, everything, so they can avoid dangerous combinations.
Really good advice. Okay, so treatment's underway, hopefully avoiding any issues. What's the follow-up plan? How do you know they're really gone?
Generally, the recommendation is a follow-up visit about a month after starting treatment.
What happens then?
The vet will likely do another ear swab, check under the microscope again to confirm there are no mites left, and do a general physical exam to see how the ears look.
And assuming the mites are gone, what's the usual outcome? The prognosis.
Generally, it's really good. With the right treatment done properly, most pets recover fully.
But what if the itching or discharge doesn't go away, even after treatment?
Well, if the signs persist, it might mean there's something else going on besides the mites, or may be complicated by the mites. Like a secondary infection bacteria or yeast often jump in when the ear is irritated. Or maybe there's an underlying allergy that was masked or worsened by the mites.
So persistent signs mean more investigation is needed.
Exactly. Don't just assume the treatment failed. There might be another layer to the problem.
And what if the mites just keep coming back? You treat them, they're gone, then a few months later they're back again.
That almost always points to an ongoing source of infestation. Either not all the pets in the house were treated initially,
Ah, the contagion factor again?
right, or maybe the environment wasn't cleaned well enough and the pet is getting re-exposed from lingering mites. You have to find that uncontrolled source.
Makes sense. Okay, let's try and sum up this deep dive on ear mites. What are the absolute key takeaways for everyone listening?
Okay, so main things. Ear mites are common, especially, but not only, in young pets. Big signs are intense itching and that dark, chalky ground ear discharge. Diagnosis is usually straightforward with an ear swab under the microscope.
And treatment works well, lots of options, but you have to be careful.
Yes, various topical and systemic meds are effective. But, and this is huge, be super aware of the contraindications, especially ivermectin moxidectin in sensitive breeds and young animals. Always tell your vet about all meds.
And the golden rule seems to be treat all pets in contact and don't forget to clean the environment. Consistency is crucial.
That's the winning strategy right there. Treat everything and everyone involved.
Okay, so here's something to chew on, a final thought. We've talked about different treatments, some fully approved, some used off-label, like that ivermectin example. We've also talked about the need for real caution with drug sensitivities and interactions. What does all this complexity, even for something as common as ear mites, tell us about how we manage these seemingly simple parasite problems in our pets today? It kind of suggests that even for the everyday issues, there's often a lot more nuance, a lot more evolving understanding than we might initially think. Definitely more than meets the eye or the ear in this case. Thanks for joining us for this deep dive.